when the patient's time is called, and they have an appointment time every day, that's when their scheduled treatment time is. Typically, they're brought back by the therapist. They'll have marks on their skin, little X marks or tattoo dots, and there's lasers in the room that orient everything to the machine, and the therapist will carefully lie them down on the table and put them in a mobilization where it holds their feet exactly where they need to be, and then they line them up to those X-ray marks or the lasers. And once they're in that position and everything's set, the therapists walk out of the room and the door closes and they're watching the patient on the video camera. Then they take the X-rays that verify the position and do any shifting they need to do, and that takes a minute or two. And the patient will be moved, sometimes even 2 millimeters, just to get them exactly where they want to be. Then, without any motion of the patient, without having to come back in the room, once the patient is exactly where we need them, and they're watching on the monitor, if the patient moves or has a problem, they'll come right in and check them out. But as long as the patient's lying still and everything goes smoothly, they'll start the treatment. And the machine gives a treatment, typically 7 treatments or so around the body. So they're laying on the table and the machine just gives a treatment for a minute or two, shifts 20, 30 degrees, gives another treatment, shifts, gives another treatment. And so by the time the 15-minute treatment is up, the patient basically has been treated all the way around 360 degrees. Again, there's no pain to it. They don't feel any difference. It doesn't make them sick. When the patient is finished with their treatment, the therapists come back in the room, they get the patient up, he gets dressed and leaves. He can go back to work, he can go play golf, he can go work in the yard. You know, it's basically he's got the rest of the day for himself.